Now, earlier this year, I reported on OutbreakNewsToday.com about how Singapore officials were reporting an increase in dengue fever cases in 2018, particularly an increase in the number of cases during the last 2 or 3 weeks of the year, going into the early part of 2019. And according to the National Environment Agency, or the NEA, the total number of dengue cases reported in 2018 was 3,285, which was about 20% more than what they saw all of 2017. So one of the concerns was this going to become a surge for 2019? And I think here we are at August 16 of 2019, and we can definitively say, yes, it has been a surge. So let's take a look. And this is the latest data from the National Environment Agency in Singapore. And according right here, they say the cumulative number of cases for 2019 during the first 32 epi weeks was 9,755. So here's the end of week 32, epi week 32, and so that doesn't include this past week between Sunday and today, Saturday. So that's another 418 cases. So we're clearly over the 10,000 case threshold in Singapore. And you can see the charts here of how dengue in Singapore has really skyrocketed in the past couple months or so, because 2019 is the red line, and you can see it out here on the chart. Then right around week 17, 18, it just started shooting up and up and up, reaching a high of somewhere around 650-ish. It looks like it's come down a little bit, but it's still pretty high. In addition, as of earlier this week, there were 137 active dengue clusters in Singapore. So they say between January and June this year, about 60% of all mosquito breeding habitats detected were found in residential premises, with the percentage found in residential premises at dengue cluster areas even higher, more right around 70%. So clearly there is a need for residents and premise owners to be vigilant in eradicating possible mosquito breeding habitats. And they, of course, give the advice, the 5-step Mozzie wipeout, Mozzie being mosquito. Turn over the pail, tip the vase, flip the flower pot, loosen the hardened soil, clear the roof gutter, and place BTI insecticide inside it. But yeah, Singapore is having a spike in cases this year after 2017 and 2018 were significantly lower. But that hasn't always been the case. It's been quite cyclical in Singapore. Now, couldn't find any official data from the Ministry of Health or the National Environment Agency, but this report from the end of July from Channel News Asia tells us that there were 9 fatalities so far in the first 7 months of the year in Singapore. So there may be a few more, but as of Monday, July 29th, there were 9. And they reported that based on a joint statement from the Ministry of Health and the NEA. Okay, well, there's this interesting study that was published in the American Journal of Tropical Medicine and Hygiene, and they looked at dengue in Singapore for a 12, 13-year period from 2004 to 2016. And let's go over it. It's got a little history in it, and it's got some numbers and some good stuff in here. So Singapore has experienced periodic dengue epidemics despite maintaining a low Aedes house index. Each epidemic was associated with a switch in the predominant serotype. We investigated the temporal dynamics of dengue fever and dengue virus and analyzed the epidemiological and entomological patterns of dengue in Singapore from 2004 to 2016. The case surveillance is based on a mandatory notification system that requires all medical practitioners to report clinically suspected and laboratory confirmed dengue cases. Circulating dengue virus serotypes are monitored through a virus surveillance program, and entomological surveillance involves inspections for larval breeding and monitoring of adults using gravitraps. Singapore experienced a similar epidemic pattern during 2004-2007, and then again in 2013 and 2016, and we'll see that in a chart form momentarily. I apologize to the podcast listeners that you won't be able to see that. The pattern involved a 2-year dengue virus 1 epidemic occurring after a switch in the predominant serotype from dengue 2 to dengue 1, followed by a lull year. Therefore, the predominant serotype switched back to dengue virus 2, tailed by a small-scale epidemic. Okay, so let's take a look at some more of the specifics. And here's a little bit of history concerning dengue in Singapore. In Singapore, dengue is epidemic because of the presence of vectors of the dengue virus, which include both Aedes aegypti and Aedes albopictus mosquitoes. The first dengue fever outbreak in Singapore was reported in 1901. An outbreak of dengue hemorrhagic fever involving 70 hospitalized cases was recorded in 1960. Following then, large epidemics occurred almost every year in the 60s, affecting mostly children. So let's go ahead and take a look at some of the charts. And I'm sorry, I'm getting to it. Okay, here we go. So here we have a chart, in the highest proportion of dengue hemorrhagic fever cases, which was 2.7 in any single year during this time frame, was in 2005. And typically it's below 1% in most years. Between 2004 and 2009, it was 1% or higher each of those years. But since then, it's been significantly lower. The highest case fatality rate was recorded in 2006, 0.3%. And in that year, they actually only had 10 fatalities, but they only had 3,000 cases, right? So now if we look at the chart, we can see that some years, right, in the previous articles that I showed you, it's been pretty quiet. 2018, a little over 3,000 cases. 2017, even less. But you can see from 2013 to 2016, dengue was really ramping up in Singapore with a high of 22,000 cases in 2013, which is the highest of all the years in this study. And the fatalities due to dengue range from about 24 in 2005 and 2007 and down to single digits in most of the years. Adults, unlike in previous outbreaks like back in the 60s where it was pediatric cases, adults were more affected by dengue infection in the 25 to 44 year age group. The proportion of notified cases in the age group greater than 55 years was higher in dengue virus 2 predominant years when compared to dengue virus 1 predominant years. Okay. Let's get some more data here. Men consistently constituted a higher proportion of dengue cases, about 6 out of 10. And there was a significant difference in the IR between ethnicities across all the years. Singapore residents of Chinese ethnicity had the highest IR, followed by Malays and Indians across all the years. Concerning premises, as in this year, it's mostly homes. And during this 12-year span from 2004 to 2016, if you look at the chart, you can see that the orange line are houses. And that's been consistently higher every single year. Uh, Significantly higher, actually, than private apartments and public apartments. Entomological findings. Aedes aegypti constituted 55% of Aedes mosquito breeding detected in and around residential homes during this 12-year period. The major breeding habitats for both Aedes aegypti and Aedes albopictus were domestic containers, ornamental containers, flower pots, and discarded receptacles. Aedes aegypti was primarily urban environments, while Aedes albopictus was ubiquitous but in higher proportions in less urban areas with greenery. So when they look at the discussion here, it says the epidemiology of dengue in Singapore over the last decade showed some interesting trends. Although all 4 dengue virus serotypes have been endemic in the country since they were monitored in the 80s, the predominant serotypes associated with epidemics in the last decade have oscillated between dengue virus 1 and dengue virus 2, whereas the proportions of cases due to dengue virus 3 and 4 have remained low. The last time dengue virus 3 was dominant was 1998. And dengue virus 4 cases have been essentially sporadic and not really involved in any outbreaks. Let's see. And let me go down to the conclusion. So basically, in summary, they say Singapore experienced an oscillation of dengue virus 1 and dengue virus 2 epidemics during this 13-year period. Older adults appeared to be more affected by dengue virus 2 than dengue virus 1. Although there's no major shift in the types of breeding habitats for the primary vector Aedes aegypti, its distribution has expanded across the island. And here's the key. Singapore continues to be under threat of dengue epidemics. And I would say that 2019 classifies as a dengue epidemic concerning Singapore. Anyway, and just remember to continue to follow our continuing coverage on OutbreakNewsToday.com concerning dengue fever in Singapore and everywhere else. We cover it pretty thoroughly. What's going on in Latin America, Asia, right here in the United States, and everywhere in between. So keep an eye on that. Keep an eye on what's going on in Bangladesh. Some really astounding numbers happening in Bangladesh right now. Anyway, I appreciate you watching. Share it with your friends. Subscribe to the show. And check out the website, OutbreakNewsToday.com. And I'll see you next time.